So you want to know how employers can cut health benefit costs? Well, in this video, you'll learn all about employer solutions for lowering employee health benefit costs. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon, and this channel is all about routine medical conditions, self-care, and cash pay healthcare options so you can be informed and in control of your healthcare decision making. If you want to know about fact-based healthcare, tap the subscribe button below. We get contacted by patients, employers, and providers regularly looking for ways to ease their healthcare burdens. So feel free to reach out with an email or hit the comment section below. So here's a summary of what this video is all about. So in this video, we will review health insurance industry claims about health benefits, why health premiums balloon, ways to cut healthcare premiums, and discover an innovative cash pay product where employers and employees can manage deductibles and out-of-pocket healthcare expenses. But before we get into it, we have to let you know about this disclaimer. The information provided by HEALTHdrum is for educational and informational purposes only and is not a substitute for professional medical advice. Consult a licensed physician for medical advice, diagnosis, or treatment. You can pause the video at any time to read it completely or read it in the description below. So the industry makes lots of claims about the benefits of employer-sponsored health insurance, but they're in the business of selling these plans and supplemental plans. So they want you connected to buy more of these plans. So let's check out some of these claims. The insurance industry claims that health insurance helps reduce absenteeism, keeps employees healthy, improves productivity, and generates better morale. And it highlights wellness care and annual checks. However, there's no scientific evidence that any of these claims, including wellness care and annual checks, lead to overall improvement in employee health. So employer-sponsored health benefits became mandated by law because basically employers were an easy target. So let's look at some reasons as to why healthcare premiums continue to balloon. By far the biggest reason for ballooning healthcare premiums is the unnecessary coverage of routine care services. The health insurance industry is about the only insurance that covers routine expenses. For example, your car insurance doesn't cover the cost of a new tire. You do. Shockingly, over 2/3 of all the healthcare delivered is generally affordable routine office-based and outpatient care. Another problem is that insurances use risk pools to group bunches of people together to average out premium costs. This means that those making good lifestyle choices are paying for the premiums of those that are not making good lifestyle choices. This is highlighted by the fact that some 50% of the population consumes 98% of all healthcare dollars. And the administrative services required to cover generally affordable routine care saddles everyone with administrative fees. These and broker fees are all baked into the cost of health premiums. And because the health insurance industry controls virtually all pricing, access, and delivery of health care, there's a total lack of market forces. Additionally, the insurance-based system is easily manipulated to enable fraud. These costs also are baked into the system and passed on to users. As a consequence of these ballooning healthcare premiums, employers are looking for cost-cutting measures. So let's look at some of these possible options for employers. So here's a list of some options open to employers to cut health benefit costs. Remember, over 2/3 of all the healthcare delivered is generally affordable routine office-based and outpatient care. Therefore, employers should sign up for plans with the biggest deductible so employees are still covered for major medical. As well, they should consider dropping supplemental policies or limiting them and avoid overly generous drug plans. In addition, employers may consider increasing employee cost sharing and introduce HRAs. So let's look at a very innovative healthcare marketplace product that was designed so employers and employees could connect directly with physicians and providers to manage their deductibles and out-of-pocket healthcare expenses for routine care. This is the HEALTHdrum product, and it was well designed to benefit employers, employees, physicians, and other providers, since over 2/3 of all the healthcare delivered is generally affordable routine office-based and outpatient care. As well, with this product, there are no contracts or enrollment periods. The product features a robust search mechanism, convenient design, cost transparency, ability to compare services and costs, easy appointment scheduling, request system, and an efficient payment platform. This amazing product avoids the many complicated rules, inefficiencies, and expenses that plague the current insurance-based system for routine care. So let's check out some of the features that are of great benefit to employers. For employers, the cash pay product adds flexibility and options to the benefits package. High deductible and self-funded plans help employers lower health benefit costs while retaining coverage for major medical. And it cuts administrative burdens as well as the many barriers to access by eliminating referrals and authorizations. It avoids contracts, co-pays, networks, and surprise bills. As well, it enables priority access. And there's an employer dashboard to onboard employees. So let's see how the HEALTHdrum Cash Pay Healthcare Marketplace product can benefit employees on high deductible and self-funded plans. As well, this product helps part-timers, the uninsured, and gig workers access routine healthcare needs. Here's just a few of the many benefits of the HEALTHdrum Cash Pay Healthcare Marketplace platform for employees, part-timers, uninsured, and gig workers, especially when over 2/3 of all the healthcare delivered is generally affordable routine office-based and outpatient care. This healthcare marketplace platform is open access, online, on demand. It has cost transparency services, enables comparison of services and costs, eliminates many of the barriers and restrictions to routine healthcare access, such as contracts, enrollment periods, referrals, authorizations, networks, and surprise bills. Even better, it enables priority access and avoids the usual appointment scheduling delays when using health plans. So I want to let you in on another fact that I will summarize in the following screenshot. This is very important because most people on high deductible plans will never meet their deductible and cash pay for services. So follow me on this screenshot. So in this screenshot, we want to underscore that it is legal to cash pay for healthcare despite having a health insurance plan. A lot of physician offices and physicians themselves are unaware of this fact. So use cash pay without filing an insurance claim, as it avoids insurance-based pricing and co-pays. Instead, if you cash pay without using your insurance, you get better market pricing as well as the other benefits that we mentioned before. So in this video, you learned that many health benefit claims are exaggerations. You learned why health premiums balloon, about ways to cut healthcare premium costs, about an innovative cash pay product, and the many benefits of cash pay healthcare. You will, of course, understand that healthcare is financially driven and that healthcare marketing is psychologically driven to bring you to the financially driven side of healthcare. This prescription may well be the reason that most published healthcare research studies are false and why only 11% of medical treatments are of known benefit. To learn more about routine medical conditions, self-care, and cash pay healthcare options, check out these other videos.